Today, we're diving deep into a topic that affects millions of people but often goes ignored until it's too late: spinal arthritis. If you've ever experienced stiffness in your low back, aches when you wake up, or pain after sitting for too long, you might be on the early path towards arthritis in your spine, or it could just be normal aches and pains of life. How can you actually tell the difference? In this video, we'll go over that and how you can substantially reduce your risk with the right habits. So what is spinal arthritis? Let's break it down. Arthritis in the spine, also known as spinal osteoarthritis, is a condition where the tissue that cushions the joints in your spine begins to wear down. As this protective tissue deteriorates, bones may rub together, causing inflammation, pain, limited movement, and eventually bone spurs. Common areas that this affects, really it's basically your entire spine that could be affected. So lower back, neck, middle back, all of those areas can be affected. There are a few major causes and risk factors that you should be aware of. Age, it's most common in people over 50 because older people commonly have decades of wear and tear, but symptoms can and do start way earlier, especially with repetitive stress from jobs, sports, poor posture, previous injury, car accidents, sports injuries, especially contact sports, or even a fall can kickstart degeneration, as well as poor lifestyle, obesity, smoking, lack of movement. All of those increase your risk. And then genetics can sometimes play a part because of the cards that we're dealt can predispose us to certain joint issues. And here's where chiropractic care comes in. With focused structural chiropractic care, you can give your body its best chance to prevent arthritis in the spine by identifying shifts in the spine that could lead to that repetitive stress and arthritis, restore motion to those affected areas, which not only reduces the chance for arthritis in that area, but even more importantly, increases your nerve function, which can have incredible downstream effects. Side note, if you want to see a video that I did recently debunking the most common myths about chiropractic, I'll link it at the end of this video. But even though I could talk about chiropractic for the rest of this video, here are some helpful tips outside of chiropractic that can help lower your risk for spinal arthritis. Number one, movement is medicine. Our joints were meant to move. When you stay active, you're keeping blood flowing to your discs and joints, reducing stiffness and maintaining flexibility. Some great exercises are walking or hiking, swimming, which is very low stress and amazing for joints. Yoga or Tai Chi for flexibility, strength training, especially core and back muscles. Also, avoid prolonged inactivity. Sitting too long leads to tight hips, compressed discs, weakened muscles, along with many other effects from a sedentary lifestyle. It really is true to an extent that if you don't move it, you lose it. Number two, build a spine supporting core. Your core muscles stabilize your spine and help to distribute stress evenly. Without a strong core, your vertebrae and discs start to absorb way too much pressure and can lead to increased injury risk. Pro tip, focus on core endurance, not just crunches. You want slow, controlled movements that build strength and stability. Tip number three, eat for joint health. Inflammation plays a huge role in arthritis. That's why anti-inflammatory diets is one of your best defenses. Now, which diet you choose is totally up to you, so I'll keep it very basic here and suggest adding in to whatever diet you choose bone broth for collagen and joint health. And it's highly recommended that you avoid all processed foods, excess sugar, refined carbs, and seed oils. And then number four, fix your posture. Sorry, the chiropractor hat is back on for a minute. It is well documented that bad posture creates uneven wear on your spinal joints over time, and this can cause arthritis to develop earlier, especially in the neck and the lower back. So quick posture tips: keep screens at eye level whenever possible, and sit with your feet flat on the floor, and use a lumbar support if you sit a lot. Set up a timer and stretch every 30 minutes if you can. And then number 5, maintain a healthy weight. Your spine carries the weight of your entire upper body, and excess weight puts additional strain on your discs and joints, especially in the lumbar region. Did you know that for every 10 pounds of extra weight, your spine feels about 30 to 40 pounds of extra force when walking or going upstairs? Next tip, sleep right. Believe it or not, your sleeping position can impact spinal alignment and joint pressure. Try sleeping on your back with a supportive pillow under your knees if possible. It's worth it definitely to invest in a firm or medium firm mattress and then a pillow that supports your natural neck curve. And if you want to know what my favorite pillow is, I'll have that video pop up at the end of this one. So to summarize everything that we've talked about, number 1, see a great chiropractor. Number 2, move your body. Number 3, build a spine supporting core. Number 4, eat organic whole foods that God made. Number 5, mind your posture. Number 6, maintain a healthy weight and sleep well. That's it for this one. If you've learned something new today, give this video a thumbs up and hit that subscribe button for more health content like this. And let me know in the comments, what's one habit that you're working on for a healthier spine? Also, check out this video next for my favorite pillow ever.